um, we came in here after you had left. And so I wonder if you'd do me a favor and just, without telling us what you've been told, okay, could you just tell us what brought you into the hospital today?
Oh,
What happened?
she's like, if she eats, she burps good and everything, but when she eats, after she's done, it all comes back up, and she like stiffens her whole entire body up, like she's in pain, and her stomach's like rock hard. And I suggested it to the doctors before, but they kind of brushed it off, like nothing was wrong.
How old is she?
She's 2.5 months.
2.5 months old. So when did this problem start?
It started like a couple weeks after she was born, and then it progressed, like it got worse about 4 days ago. It's been going on like nonstop, and it's at every feeding.
Okay, so at about 2 weeks of age,
Mm-hmm.
you say that she started having some vomiting after feedings. Was it every feeding?
Not at first.
Okay. And was there anything else besides the vomiting? Did she seem to have any other kind of an illness, fever, diarrhea, anything else?
Mm-mm.
Okay. What were you feeding her?
She's on Similac Advanced.
Okay. And how much does she take?
4 ounces, like every 3 to 4
Every
hours.
3 to 4 hours. Okay. Was there any pattern to the vomiting? Did it seem worse some parts of the day and better other parts of the day? Any pattern that you can think of? Or?
No.
No. And you can't think of anything that you did. You say you took her to the doctors. What did they recommend?
They just said since she's gaining weight, they're not going to do anything about it.
Mm-hmm.
But now she's lost like 2 pounds, and they're concerned about it.
Okay. Well, let's talk about that. So she was, is this your first baby?
She's my third.
Your third baby, okay. Was she born term?
Mm-hmm.
Okay. Any problems during your pregnancy with her?
I have fibroids, so I had an infection and it got passed on to her, and she had to stay in the hospital for a week because of it.
But she was born at term?
Mm-hmm.
Oh, okay.
And I had to have a C-section.
Yeah. Okay. Had you had section before?
Mm-mm.
Okay. Did they say that she was having some distress or?
She was real sleepy. Like, I went into labor on my own, and she seemed like real tired.
Uh-huh.
So they decided to do a C-section.
Okay. And then you say when she was delivered, do you remember her APGAR scores?
Do I remember who?
APGAR scores? Did they say anything to you about those? Okay. When she was delivered, you say they took her immediately to like an intensive care
To
area?
the NICU.
Okay. And what did they do for her there? What did they do with her?
She was on a 7-day course antibiotic, and then they checked her temperature like 3 times a day.
Mm-hmm. Okay. Did she have to have a intubation or no? Wasn't put on a ventilator?
She was just in the NICU in a regular room.
In the regular room. No extra oxygen?
Mm-mm.
Oh, okay. Did they say that she actually had an infection, or they felt that she actually caught it?
Her white blood cell count was high. I don't remember how high it was, but they said it was pretty high, so they think that it was caused from an infection.
Okay. So she recovered from that for a week in the hospital, and you got to get her home.
Mm-hmm.
And it was only then, probably a week after that, that you started noticing that she was throwing up, right?
Mm-hmm.
Okay. But she was maintaining okay until recently when she lost, you could tell that she was losing weight.
Mm-hmm.
Okay. And was that kind of like the last straw to you that you just said,
Yeah.
you know what, this is not right? Was that it, or was it the vomiting?
I knew